What's going on, YouTube film? All right, I'm looking really rough, really raggedy. I have absolutely no makeup on, and I don't care. So if you want to see makeup with me with makeup, check out my makeup channel, Kid Latoya. That's my channel name. Anyway, so this quarter's finally over. My first quarter of nursing clinicals finally done. Man, it was it's a lot of reading. Next quarter is definitely going to be a whole lot, a whole lot tougher than this quarter. This quarter wasn't actually so bad. I didn't have to really study so much. I got a B for my final grade. Got a really good, decent grade on my final. Kind of maintained a B average throughout this quarter, actually, for on my tests. So that's cool. I'll take it. I'll take a B in clinicals. Yeah, definitely take a B. I guess a recap on what we learned this quarter, physical, head to toe physical assessment, asepsis, medical, and sterile, I believe. Yeah, either medical or sterile or surgical. I forgot which one it is. That's sad. I'm not thinking properly. I've been like a week or two out of school. It's been over for like a week or two, and I just obviously I'm drawing a brain fart. So yeah, we did bed transfers, bed bath. I said bed transfers, transferring patients, bed bath, vitals. Like I said, asepsis, head to physical assessment. I'm trying to think what else. Making up beds, just pretty much the foundation. Well, just like simple things, really, almost what like a CNA can do. That's what we learned this quarter. Next quarter, I am so excited. Gerontological nursing, OMG. We're going into meds, subcutaneous injections, and things like that. Oh, I'm so excited. Catheters, irrigation of pressure ulcers, and what else? Elimination. Urination. Goodness, what else? Oh, setting up sterile fields, because you gotta set up a sterile field for irrigation, and also for, I believe, definitely for catheters. So I'm super excited. I have to refresh my asepsis because we went over it, but mostly it was for basic hand hygiene. So we're gonna be setting up sterile fields, and I'll be popping out my sterile gloves. I did a video. Somebody asked me to do a video how to put on sterile gloves. So finally get to put that technique to use and set up full sterile field. So I'm super excited. We have a crap ton of meds that we need to learn. Like, they put our syllabus out last week, and it's like 30-something pages long. So I've kind of started studying. Actually, I started doing my flashcards already. This is how I do my meds. Oh, yeah. I should show you. This is how I do my meds. My meds flashcards, and, like, my abnormal findings, like, as far as lab reports and things like that. I do my meds like this, and to get the big ones, and I post I hole punch it twice or whatever, and then when you flip it that way, it has interactions, what to look for. Not everything that will be in a med book will be on here, but just like the main stuff that you need to look for, like overdose, what to know when you're looking for, what to look for when if a patient has overdosed on whatever meds, interactions, the major interactions, and stuff like that. And from a pharmacologic class and the therapeutic class or whatever, for every drug that we kind of touch on or read about, I want to make sure I know. So that's how I do my my med flashcards, and my abnormal findings, skin findings, I guess fluids and stuff like that, like sodium numbers, what's normal, what's out of normal, and things like that. I make a card like this, so I just quick, easy reference so I can flip through, and I put this in my binder. So, and that's for next quarter. I've already started on next quarter. Doesn't start until the very first, I think January 3rd. So, but I'm getting starting ahead because a lot of stuff we're going to be learning. Diabetes is huge in nursing, and so many things can go wrong. Just the chapter alone for diabetes in my med search book is absolutely outrageous. There's two books that I'm missing that I need for this quarter: gerontological nursing book, and I believe another book. And when I do get those books, I'll definitely share them with you, let you see what they look like, and whatnot. So yeah, I'm excited. Just kind of, you know, reading, refreshing what we went over this quarter, because I don't want to lose that information. I definitely don't want to forget it. You need it, and whatnot. And I have to refresh on my math and whatnot. My drug dose calculations, because my dosage calculations, because on the very first day of school, I've got a math exam, and we have to pass with an 80 because they're trying to qualify us to push meds. And last quarter, we had technically 4 agency visits. One was to a school to do hearing and vision testing, and then 3 visits with our client, where we did, you know, broke up the head to toe physical assessment. We did parts of the head to toe physical assessment, and then when you combined all 3 visits, it was a full head to toe. So and vitals and whatnot. So but next quarter we'll be actually in the hospital, and I think we have 11 agency visits. So pretty much almost every week we'll be at the hospital doing our skills. I think we do 2 weeks in the lab. I know 2 weeks straight in the lab, learning, make sure we can set up Serofield, making sure we know elimination and stuff like that. And I don't know if we starting our catheters. I think we are, because I checked my lab guide for the first day, and I believe we do have to go over, watch a video on urination and elimination, stuff like that, and catheters. So that'll probably be the first skill that we learn. I'm positive there's going to be a check off on that, and I think we have a quiz in math, and then a quiz for lab first day of school. So I'm super excited. That's pretty much it, guys. I'll definitely be keeping you posted. I didn't really do a lot of posting this quarter, only because a lot of stuff that we went over, like, you know, the last couple weeks of school really wasn't, we didn't learn any skills. You know, we had learned the full head to toe physical assessment. We were finished with all our agency visits, and we just went over like culture and nutrition and things like that, like deficiencies, you know, vitamin deficiencies and stuff like that, and like vision abnormalities, like you know, glaucoma and different disorders, and musculoskeletal disorders, like different arthritises and osteoporosis and stuff like that. So, and I don't know, I just kind of felt like that may have been boring to share. I don't want to teach a lecture, you know. So, but next quarter I'll definitely do more videos, because I just feel like we're going to be getting our hands dirty in nursing, like, you know what I mean, like really jumping in there and really doing some really neat skills. So I'm excited about that, and I'll post more videos. So this is just a quick update, just to let you know that school's out. I'm done with all my non-clinical classes. A&P is finally over. Thank God, because I was so over A&P. A&P could go suck it for like right now. That's how I feel. I was so over. I didn't even really don't do what I did this quarter for A&P. I didn't study. I couldn't put a lot of time in A&P. A&P got the boot. It got pushed to the very, very, very back burner. Because I couldn't put a lot of time in it. I got a B in it, but I couldn't put a lot of time and effort in A&P. I need to focus on my time and effort in my clinical class. So, but I'm done. I have no more non-clinical classes left, just clinicals, and that's it. 1 class per quarter. So that's it. And yeah, that's pretty much it. First week of school, like I said, when I get my books, I'll come and post another video, and then I'll try to do a video every week, because we're going to be doing a lot of skills, learning a lot of meds, and I'm super psyched. So, as always, thanks for watching. Don't forget to rate, comment, and subscribe, and leave me some info if, because a lot of people that watch this channel, I'm assuming, are either in nursing school or doing their prereqs, maybe in their clinicals or something like that. And yeah, let me know how, this quarter ended or semester ended for you guys, and how it's going. So, bye guys.